Aloha mai kako. Thank you for joining us in our discussion about healthcare for the Big Island. I'm Russell Kokobun. I'm a senator from the Big Island, and I serve the area of Ka'u, Puna, and part of Hilo. We're joined today in our discussion by Senator Dwight Takamine, who is the senator for the 1st District, Hamakua, part of Hilo, as well as Waimea. Also joined today by Dr. Jim Donovan. Jim is the Rural Family Medicine Residency Program Director, and Dr. Linda Dolan, who's the Hilo Medical Center Foundation trustee and also a physician in private practice in Hilo. And also joining us is the 3rd leg of our Big Island senatorial stool, Senator Josh Green for North and South Kohala and North and South Kona. You know, the reason why we're here today is we realize that healthcare is in a very serious situation on the Big Island. And as legislators, we want to address that crisis. So we are actually planning a number of different presentations along this line. We wanted to begin today, pardon me, with a issue that we think is of great concern, which is the need to recruit and retain on the Big Island. The other issues that we're going to be dealing with are the actual structure and viability of the, excuse me, the Hawaii Health Systems Corporation hospital system on the Big Island, which includes the acute care facilities in Hilo and Kona, as well as our rural critical access hospitals in Ka'u, North Kohala, and Honoka'a. The third issue that we're wanting to deal with is the long-term care crisis, or the long-term care bed issue on the Big Island. We think that's in need of great help as well. The other area, finally, is the community health centers. They provide a huge supplement and complement to our healthcare provision on the Big Island. So we'd like to talk about those clinics as well as the Native Hawaiian health programs that benefit our community as well. So we're going to begin today, though, with our discussion about the recruitment and retention of physicians. We had a great program that was developed here at the legislature, and I'm going to let Senator Green enlighten us about what that involved.
Thank you, Russell. Just to give people an overview about where we are in Hawaii and where we are nationally as far as our physician workforce, in rural areas, especially across the country, we have a great deal of difficulty having good enough coverage, having enough physicians that can cover and practice in the rural areas. And everyone is well aware that the Big Island is a rural area. So much like the rest of the country, we have a shortage of primary care physicians. And what we need as a community is an adequate number of primary care physicians to take care of all of the kind of bread and butter health problems that we have. Having enough primary care docs means that we don't have as many people in the emergency departments or as many people with chronic illness getting sicker and just suffering. So we have recognized both with the medical community, that's why we have our medical experts here today, and at the legislature, that we have to support the building of a base of primary care physicians. So 2 years ago, recognizing this problem, we passed a bill together. Dwight and I were in the House at the time. Russ was already in the Senate, of course, and in collaboration, we passed a bill to start the residency program in Hilo. It's been an ongoing, of course, challenge and dialogue for many years, but we did pass the bill, had many hearings, had total consensus in the legislature that this was a priority, to grow our own docs, basically, to train family practice docs. I actually trained in family practice before I came to the legislature back in the 90s. So I came to Hawaii as a family doc, still do that. But we decided the best way to solve the problem is to grow our family docs here at the residency program, and then they will stay. So we passed the bill and appropriated over the 2 years a total of $4 million. $4 million to completely fund the faculty positions, to help with the facilities, to make sure that we could have a competent residency program, something that would be a terrific place that we could grow these docks on the Big Island, in Hilo basically, but to be able to farm docks out, to train, and then we would begin to solve our problem internally. Unfortunately, I guess the budget turned south, and there were other problems. I guess we didn't have a full appreciation, I guess I could say, of the problem. And in spite of virtually unanimous support in the legislature to pass this, to create the Rural Family Practice Residency Program in Hilo, the money was never released. So that $4 million just never became available. And so kind of because of the good-hearted doc and the team in Hilo, we've kind of kept it on a wing and a prayer, putting it together. But we've decided that it is important enough not just to come to you in the community as our first presentation today about how we're going to solve the healthcare crisis here to talk about it, but to bring it back as an issue again, to sponsor the bill again, to pass it out of the House and Senate, which is what we're doing right now, and to kind of retake up the fight, to fight for the resources that we can get, that we need to get to grow these docks here on Big Island.
Great. I think that's going to be an issue, though, because it does have the funding in there again, and I'm not sure how, given our tight budgetary situation, how we're going to deal with that. But with that particular bill, I think we're also considering putting together a resolution that would help us have the program get on its feet and up and running. And Dwight, I know that you were key in putting that together. You want to mention that or talk about your concerns?
I think it's very clear, even in all of our discussions with the community, that healthcare is essential. More so on the Big Island, you have a number of hurdles, as Josh has described. And I think one thing we've learned over the years is that when the community and government is working hand in hand, you get the best results. As Josh indicated, unfortunately, the administration did not see fit to release the funding. But that's why, I appreciate so much the kind of community we have on the Big Island. And certainly when, a service or a need is described as essential, many times there are those individuals that step forward to help provide the important leadership to ensure that those services get provided